uh, having problems. They are not having good answers with allopathic treatments, so they always approach for Ayurvedic treatments. And there are many neuromuscular diseases. There are many names, many disorders, and we have to offer a good Ayurvedic treatment. Ayurveda says there are human diseases are unlimited. How many diseases, how many elements were in the past, and how will be in the future? There is no definite answer. But Ayurveda says that although the number of diseases may be unlimited, if we focus on the basic causes of the pathology, we can fight and we can offer a good treatment of these several neuromuscular diseases. The basic degenerative process which are involved in several neuromuscular diseases, while the deterioration in neuromuscular system is a very complex phenomenon. Most of its manifestation could be traced to the basic degenerative process. And we can identify 5 basic degenerative processes. These are the oxidative damage, the inflammatory process, the integrity of the membrane, the mitochondrial dysfunction, and the insulin resistance. These are the 5 basic degenerative processes which are involved in the neuromuscular elements. Now the role of AMA is very important when we offer Ayurvedic treatment. In neuromuscular, including muscular dystrophies, both the damaged muscle cells and immune cells produce a special chemical, an inflammatory chemical called AMA, and because it acts like an antigen, so it is, we call it toxins, and because it is produced by our own body, so we say it is an autotoxin produced by our own body. So AMA destroys muscle fibers and it makes muscle and body hostile, so new muscle cells cannot grow and survive. There are Ayurvedic herbs which can slow muscle wasting, muscle weakness by decreasing muscle inflammation, and Rasayana herbs, Rasayana molecules also boost the satellite cells in the muscle which help in the regeneration of muscle fiber. Now the treatment agenda of the Ayurveda. Ayurveda is always focused on dosha prakriti of the patient and his peculiar individual clinical condition. Ayurvedic treatment agenda can include Panchakarma procedures, then oral Rasayana supplements, Rasayana herbs, medicines, and we always combine our treatment with yogic support. So Ayurvedic treatment agenda should always be evidence-based, it should be safe, and it should be affordable. This is very common problem, autism. There is abnormal biology, chemistry in the brain. Clinically evaluated Panchakarma procedure such as oil massage, Abhyanga, Surudhara, Nasya, Suroleva, along with suitable diets are recommended according to the requirement of the patient. There are several Medhya herbs. Most popular are Vithania somnifera, Ashwagandha, Bacopa, Mallory, Centella asiatica, means gotukola, and Convolvulus pluricalis sanctuspi. These are very effective herbs which we can add as a food supplement or as a special food for the management of autistic children. There is another problem which is very common in European countries, in India also, because here people, and also now we are living in a modern lifestyle, we are eating an unhealthy diet, our sleep is disturbed, our lifestyle is very unhealthy, so there is always, the motor neuron disease is always increasing, and there are some herbs Especially, we are working on a special combination of Mansagnisina. It is a combination of curcuma longa and ashwagandha, Lithania somnifera, and boswellic acid. This particular house is found very effective in the management of motor neuron disease. We always combine this treatment with Panchakarma procedure like TMP therapy, Tilmas Pindisvedana, physiotherapy, and yogic support. So we always integrate Ayurvedic treatment with other modalities of treatment. And we have found a very good improvement in the quality of life. This is muscular dystrophy. Treatment is always, this is a genetic problem, and there is no 100% cure in any system of medicine. But Ayurvedic treatment is aimed at keeping the patient independent as long as possible, and prevention is our prime concern that results from weakness, from reduced mobility and chronic and respiratory difficulties. Ayurvedic treatment may involve a combination of approaches, including Panchakarma procedure. We are using a kill mass Pindisvedana. We combine it, integrate with physiotherapy, then again Mansagni, Rasayana, and other dietary supplements along with yogic support. Parkinson is a very complex neurological disorder. Cells within the substantial nigra, they start deteriorate, they die, which control the movement of the movement and balance. So there is always problem of movement and balance. And inflammation as a key regulator of brain injury has recently come to the forefront in the biomedical research. And Ayurveda can give a unique insight in this degenerative process. Especially Bacopa meninelli can impact the brain through modulation of microglial, which are basically inflammatory cells that are found in the brain and are activated during injury and degenerative Parkinson problems. We are working especially on muscular dystrophy. We have started a project on neuromuscular disease and focus on muscular dystrophy. DMD is one of the most common, most severe inherited neuromuscular disorder, and it was one of the first disease we focus on in collaboration with Ayush Samiti of Chhattisgarh and patient groups and global expert care guidelines. A care through Ayurvedic clinical study project was initiated in 1995. Dystrophin protein is essential for the function of muscles. DMD is muscle wasting disease associated with errors in the genes that makes dystrophin. So there is a deficiency of dystrophin because of the genetic defect leading to DMD is called deletion, meaning that piece of the DNA from which blueprint to make dystrophin is lost. Ayurvedic treatment is useful in the long-term management of DMD. Patient need a good care and good support, and Ayurveda can help DMD patient. Here is a short study on the digital muscular dystrophy. We have we have a clinical study on 28 patients, which we started in a project in 1999. Then we assess the result in 2003. DMD is a progressive deterioration of the muscle fiber. There is difficulty in movement, genetic abnormality in the muscle proteins, and there is a pseudo-hypertrophy in the core muscles. And other aspect of this disease is there is a grossly elevated CPK level in the blood. This enzyme is very important. This is the usual picture of dystrophic child. There is a weakness of the muscles, and he always climb up his legs in order to spare the big hip extension muscles. This is a very popular growth signs we can identify by this posture of the disease. And we need a laboratory diagnosis. There are many methods. The blood enzymes, creatinine kind of phosphate is always raised. Then we do electromyogram. Muscle biopsy can also confirm the DND. And finally, we can test the gene analysis genetic test to confirm the diagnosis. These are the muscles pattern which involved in the Duchenne muscular dystrophy, and because of this muscle weakness, there is a disabling condition. Patient has a difficult in walking. DMD is inheritance. There are several ways of inheritance. Autosomal dominant inheritance, where mother is carrier and father is also affected. So there is a different kind of inheritance in the DMD. We can find this inheritance in genetic test of the patient. The pathogenesis of DMD, the most important is there is a lack of dystrophin protein. We know protein is very important for the muscle structure. When there is a lack of protein, the muscles become prominent. Usually inherited, but we have seen that there are cases in 30% child where there was no carrier mother or parents. There is a spontaneous mutation also there. And in pathogenesis, the main defect we see in the membrane of the muscle fiber, what we call it sarcolemma membrane defect. Because of this defect, the blood enzymes, sick enzymes leak out, and there is a muscle wasting. This leads to muscle fiber necrosis. Ayurvedic view, Ayurveda says muscular dystrophy is a Adival Pravat Masgat Bakro. This is because due to Srotaruda. So Ayurveda consider muscular dystrophy as also conventional medicine say it is genetic defect. Ayurveda say it is Bij dosa, where it converts physiological Vata element into pathological morbidity. There is a depletion of muscle enzymes, muscle mansakri, because of the AMA formation, and there is a hypertrophy and depletion of Vata element. There is a progress of wasting and muscle necrosis. As you can see, the dystrophin protein, which is on the outer layer of the muscle, it acts as a shock absorber, and because dystrophin is not producing in muscle dystrophy, so there is a breakage of muscles, destruction of muscles in DMD. Treatment agenda for the Duchenne muscular dystrophy. We always combine Panchakarma procedure, some Rasayana drugs, along with yogic and dietetic support, and of course with physiotherapy. So basically we are applying an integrated approach to manage Duchenne muscular dystrophies. And we have seen improvement after this integrated treatment agenda. We find improvement in functional ability that was visible after 6 weeks of administration of Rasayana herbs. And because we have seen there is a reduction in CPK level, there is a reduction in the weight loss, decrease in the walking difficulty, decrease in the severity of contractures, and scoliosis. So we find this Ayurvedic treatment is effective. This is result analysis in 28 patients. We used International Barthel scale and also Ayurvedic Sharir Jivan scale. There was marked relief we noticed in 42% of cases, moderate improvement in 21% cases, mild relief in 36% cases. You can see after 24 weeks, there is an average decreasement in the severity of this disease. In 45% of cases, there was average weight loss, 2.58 kg average weight loss, and there was a decrease in 2,800 unit of the CP level, and there was also decreasement in the contractures in 10% of cases. This shows the effectiveness of this integrated Ayurvedic treatment. Quality of life improvement, which is very important from Ayurvedic perspective. There was functional improvement in 40% cases. Endurance and self-confidence was also noticed in 60 and 90% of cases. There is a case of DMD. You can see the patient when he came to treatment, the deteriorated condition of the patient. And this is after the treatment. And patient himself is noting his improvement, recording improvement in the rest of the clinic. And this is another patient. Here you can see the procedure of kill mass pentosedna and the improvement, functional improvement in the child after the treatment. This is another case is a Nepali boy. He was able to lift his head after 2 weeks of Ayurvedic treatment. He was not able to open his button, but after the treatment, the functional improvement was so prominent that he was able to open his own buttons. So this is a very good sign. We are not claiming that we are restoring dystrophin protein in the blood, but definitely Ayurvedic treatment can improve the functional ability of the patient. Here is the patient. You can notice changes. So we can say that Ayurvedic treatment is effective to increase the quality of life. We can combine this treatment with standardized Ayurvedic herbs. They need a further validation, and we should always use these drugs.
So the organizers are asking to finish your lecture.
Okay.
Please do it. Okay.
So,
Okay, thank you. Please just grab the last sentence. I don't know this earlier. Please.
We should combine Ayurvedic treatment with Maharaj approach. We have not used steroid in Ayurvedic treatment. If we use steroid plus Ayurvedic treatment, maybe there may be more effective results we can find.
Thank you, Anjali. I think that's not because it is not interesting, but some people are leaving, and they are in a hurry.